Good afternoon. Today is March 30th, 2020, and we want to give you a quick COVID-19 update. I'm Rob Brandt, CEO of Mountain View Medical Center, and with me today is Eva Kerr, our Public Health Director. Current state of affairs as it stands, we still have run 5 tests in our county, of which 1 is positive. So luckily over the weekend, I think everyone kept their social distance, and so far we have not had community spread, which is the good news. We still have tests available in the clinic, and like I had gone over on Friday, that'll be gone over on a symptomatic as well as an exposure to risk analysis, and those who need testing will receive that testing. Our clinic and hospital operations for this week, we will continue with clinic operations, albeit limited in person. That we will be open today and the rest of the week with 1 provider in-house, and we will be offering telemedicine visits. So if you'd like to get one of those set up, call 547-3321 and get a telehealth visit set up, or if you need an appointment in person, that is available as well. The hospital and outpatient services, so outpatient labs, outpatient radiology, and ER are all fully operational. The only exception is the way you may come into the facility. All COVID-19 suspected patients or positive patients who do need some sort of treatment will come in through our ER ramp. Everyone else will come in through our clinic entrance. Want to really thank everyone and everyone in the community for taking us seriously and utilizing the local businesses' curbside services or delivery services and staying at home and not going out and gathering. It is working, and we urge you to continue doing this. This is not going to be fixed overnight. This will take a while. Please hang in there and utilize the curbside services and the delivery services that our local businesses are providing. I know from Friday's video there were a couple of comments that came in after our live session, so I just want to address those. First of all, after this video, if you have any comments or concerns, you can email clinical@mvmc.org. Once again, that's clinical@mvmc.org, and we can address them in a future video, or we can address them one-on-one with you as necessary. We have no other known exposures, not only in the county, but specifically in our long-term care unit. We've been in a lockdown procedure for those patients with no visitors or visitor restrictions prior to COVID-19 with our flu outbreak that has been happening. So they have no known exposures at this point in time. Another thing is people have been questioning if there are positive people in our community that have not been alerted to the public, and that is not possible. How these tests are run, we merely administer the test, take the sample, and the sample gets couriered to the state lab. The state lab then results the test and administers that data. So all the data you see on the nightly news comes completely from the state. We have no control on the release of that data, nor the release of the results. And so I want everyone to know we are not resulting these tests in-house. They are completely done at the state lab. Donations is another thing that has come up. You have 2 avenues of donation that are set up currently. The first one is the Community Foundation, and you can mail your donation to them at P.O. Box 696. Once again, the Community Foundation is accepting donations for our community for COVID-19, and you can mail donations to them at P.O. Box 696. The Hospital Foundation is also accepting donations during these hard times, and those can go to P.O. Box Q, and that is, both of those are White Sulphur Springs 59645. You know, on Friday I did name all the businesses, and I knew I may miss someone, and I truly did not mean to miss anybody, but I wanted all the businesses who had made a change in their operations to get noticed during that video and thank them. And Bird Garage, I missed you, I'm sorry, but you guys have been doing curbside service way before it was cool, so I want to thank you for that and urge you to continue that.
So I wanted to go over again today the symptoms of COVID and things to be watching for. So your symptoms may appear 2 to 14 days after the exposure, and these symptoms could be a fever, cough, or shortness of breath. Those are the things that if you think you've been exposed, you have those symptoms, you can call the hospital to get screened. If you develop emergency warning signs for COVID-19, get medical attention immediately. The warning signs are trouble breathing, persistent pain or persistent in the chest, new confusion or inability to arouse, and bluish lips or face. This is not an inclusive list. Please contact your medical provider if you're having any symptoms that are concerning. Wanted to go over the difference between isolation and quarantine today. Isolation is for those who are sick. Patients with suspected COVID-19 are isolated until testing rules out the disease, for confirmed cases. They are isolated when ill until they meet the criteria to be released from isolation at home or at hospital precautions. Quarantine is for those who are not sick but had a known exposure to COVID-19, and the duration is a standard 14 days. The restriction on his or her movements depends on the risk level of their exposure. So if someone is under quarantine for a known exposure and develops signs and symptoms of COVID-19, testing is indicated to determine if they are positive. If it's a negative, if that's the result we get, they still need to finish out their 14-day quarantine because it still could develop in that 14 days. As I said, it's between 2 and 14 days that the symptoms can show up. It's frustrating for people because they want to get cleared and want to go on, but that's kind of how this is set up right now. A lot of questions have come up about wearing face masks. Right now, if you are sick, you should wear a face mask when you are around other people, if you're sharing a room with someone or a vehicle, and before you enter a healthcare provider's office. If you're not able to wear a face mask because of trouble breathing, then you should do your best to cover your coughs and your sneezes, and people who are caring for you should wear a mask if they enter your room. If you are not sick, you do not need to wear a face mask unless you are caring for someone who is sick and they are not able to wear a face mask. Face masks may be, and they are in short supply and should be saved for caregivers at this time. I also wanted to talk today about caring for children during this time. Based on the available evidence, children do not appear to be at a higher risk for COVID-19 than adults. While some children and infants have been sick with COVID-19, adults make up most of the known cases. These are information that I'm grabbing from the CDC as well. Steps to protect our children from getting sick are to clean hands using soap and water or alcohol-based sanitizer. Avoid people who are sick. Clean and disinfect high-touch surface areas, tables, hardback chairs, doorknobs, light switches, remotes, handles, desks, toilets, sinks, and cell phones. I didn't mention that one the other day, and that's an important one. Washing plush toys, bedding, things like that is a good idea. The symptoms of COVID-19 are similar in children and adults. However, children with confirmed COVID-19 have generally presented with milder symptoms. Reported symptoms in children include cold-like symptoms such as fever, runny nose, and a cough. Vomiting and diarrhea have also been reported. It is not known whether some children may be at higher risk for illness, for example, children with underlying medical conditions and special needs. There is more to learn about how the disease impacts children. And we're learning every day with COVID-19, there's more to learn about this disease. Children do not need to wear face masks. If your child is healthy, there is no need to wear a face mask. Only people who have symptoms of illness or who are providing care should be wearing a mask. With the schools being out, I feel like we need to touch on that a little bit too, about social limitations, interactions for our kids. The key to slowing the spread of COVID-19 is to limit contact as much as possible. While school's out, children should not have play dates with children from other households. If children are playing outside their own homes, it is essential that they remain 6 feet from anyone who is not from their own house. Practice social distancing. If you are having small meetups, consider hanging out with another family or friend who is also taking extra measures to put distance between themselves and others. Social distancing. Clean hands often. Make sure children practice everyday preventative behaviors such as washing their hands with soap and water for at least 20 seconds, especially after they have been in a public place. Stay in touch with your child's school. I talked with Jackie Boyd earlier today. She said if your child's having any difficulty with school or getting their assignments and that, please reach out to their teachers. Reach out just to the school too. They have people at the front desk Monday through Thursday, Monday through Friday, and they're more than willing to help. That's what they're there for. They want to make sure that our kids are getting a good education and aren't struggling with this stuff. The lunch services for free and reduced lunches were started today to go out daily to kids. I don't think it's too late. So if you're a parent who thought you were fine, didn't need that, now you're changing your mind, thinking it's hard to have the kids home 5 days a week for all the groceries and that, please contact the school. They will work with you on that. They have the means to do that. So again, the signs and symptoms for kids is the fever, cough, shortness of breath. Call your provider, have them walk you through if you think they've been exposed. I want to talk about stress in kids too. This is a really difficult time for our kids right now. It's hard on us, but it's really hard on them as well. So some common changes to watch for include excessive worry or sadness, unhealthy eating or sleeping habits with difficulty with attention and concentration. Take time to talk with your kids and even your teenagers about COVID-19. Answer questions and share facts in a way that your child or teen will understand. Try to keep a good routine going Monday through Friday, especially with the kids starting school today again. A lot of them are doing interactive classes, and I know high schools are starting at 8 this morning. Get them on back to their routines Monday through Friday at least. Be a good role model. Wash your hands. They're more likely to do the same. One way to keep in touch with family members that you're not able to see on a daily basis at this time because of health things and social distancing is encourage your children to write letters to them, and those can be mailed to them or hand delivered by somebody else. Thank you for watching our video.